Welcome, dear medical students, to today's lecture on the fascinating field of radiology. Radiology plays a crucial role in the diagnosis and management of various medical conditions, utilizing imaging techniques to visualize internal structures and detect abnormalities. In this comprehensive script, we will delve into the intricacies of radiographic anatomy, principles of digital imaging, radiographic positioning and techniques, contrast agents in radiology, radiation protection and safety, basics of computed tomography, magnetic resonance imaging fundamentals, ultrasound imaging basics, nuclear medicine, interventional radiology, pediatric radiology, and radiology informatics. So, let us begin our journey into the captivating world of radiology. Radiographic anatomy involves the study of anatomical structures as they are visualized on radiographs. This includes understanding the normal appearance, variations, and potential pathologies that can be observed. By analyzing radiographic images, we can identify structures such as bones, organs, blood vessels, and soft tissues. It is essential to have a firm grasp of radiographic anatomy to correctly interpret images and provide accurate diagnoses. Digital imaging has revolutionized the field of radiology by replacing traditional film-based methods. Understanding the principles of digital imaging is vital for radiologists and technologists. This includes knowledge of how X-rays are converted into digital signals, image acquisition, processing, storage, and display. Additionally, topics such as pixel size, spatial resolution, contrast resolution, and image quality assessment will be examined in detail. Proper positioning and techniques are integral to obtain high-quality radiographic images. In this topic, we will explore positioning principles for various body regions, including the chest, abdomen, extremities, and spinal column. Techniques for obtaining specialized views and projections will also be discussed. Understanding the nuances of positioning and techniques ensures that radiologists can accurately interpret images and provide the best possible diagnosis and patient care. Contrast agents are substances used to enhance the visibility of certain structures or abnormalities on imaging studies. In this topic, we will explore the different types of contrast agents used in radiology, such as iodinated contrast media for CT scans and gadolinium-based agents for MRI. We will also delve into the indications, contraindications, side effects, and safety considerations associated with contrast administration. Radiation protection and safety play a crucial role in radiology to minimize potential risks to both patients and healthcare professionals. We will discuss radiation biology, dose units, radiation effects, and the principles of radiation protection. Topics such as dose optimization, shielding techniques, and radiation monitoring will be explored in detail. Understanding radiation safety guidelines ensures the responsible and safe use of radiological procedures. Computed tomography, CT, is a powerful imaging modality that provides cross-sectional images of the body. This topic will cover the principles of CT scanning, including image acquisition, slice thickness, reconstruction algorithms, and multiplanar image formation. We will also explore the clinical applications of CT, including trauma imaging, oncologic imaging, and cardiovascular imaging. Magnetic resonance imaging, MRI, utilizes magnetic fields and radio waves to generate detailed images of the body. In this topic, we will delve into the basic principles of MRI, including magnetism, the T1 and T2 relaxation times, pulse sequences, and image contrast. We will also discuss the advantages and limitations of MRI and its applications in various clinical scenarios. Ultrasound imaging utilizes high-frequency sound waves to create real-time images of the body's internal structures. Understanding the principles of ultrasound imaging is crucial for radiologists and sonographers. This topic will cover topics such as transducers, image formation, Doppler imaging, and the advantages and limitations of ultrasound. We will also explore its applications in obstetrics, abdominal imaging, and musculoskeletal imaging. Nuclear medicine is a branch of radiology that uses radiopharmaceuticals to diagnose and treat various diseases. We will explore the principles of nuclear medicine imaging, including the detection of gamma radiation emitted from radiotracers. Topics such as single photon emission computed tomography, SPECT, positron emission tomography, PET, and radionuclide therapy will be discussed, highlighting their clinical applications. Interventional radiology involves minimally invasive procedures guided by imaging techniques. In this topic, we will discuss various interventional radiological procedures, including angiography, embolization, biopsy, drainages, and vascular interventions. We will explore the instruments and techniques utilized, as well as the benefits, risks, and potential complications associated with these procedures. Pediatric radiology focuses on the imaging needs and considerations specific to children. This topic will cover radiological techniques adapted for pediatric patients, common congenital abnormalities, and pediatric-specific imaging modalities such as fluoroscopy and pediatric-specific protocols. We will also discuss radiation dose considerations and the importance of maintaining patient safety in pediatric imaging. Radiology informatics involves the application of information technology and informatics principles within radiology. This topic will explore topics such as picture archiving and communication systems, PACS, radiology information systems, RIS, electronic medical records, EMR, and the integration of radiology workflow. The impact of artificial intelligence and machine learning on radiology practice will also be discussed. Radiology is an ever-evolving field that plays a vital role in modern medicine. By understanding radiographic anatomy, principles of digital imaging, radiographic positioning and techniques, contrast agents, radiation protection, and safety, computed tomography, magnetic resonance imaging, ultrasound imaging, nuclear medicine, interventional radiology, pediatric radiology, and radiology informatics, we equip ourselves with the knowledge needed to provide accurate diagnoses and improve patient outcomes. As future physicians, your comprehension of radiology will enable you to collaborate effectively with radiologists and utilize imaging studies to guide patient care. Thank you for your attention, and I encourage you to continue exploring the fascinating world of radiology.